Gynaecologists, what is the nastiest thing you have experienced while working? I was doing clinicals at a large inner-city clinic attached to a hospital. The first patient of the day was a woman in her 50s who had recently had a vaginectomy to try and combat vaginal cancer. They had gone and removed her entire vagina. I've never seen anything like it. After we removed the packing, it was just a huge, gaping, dripping maw in between her legs. There was absolutely nothing left of her female anatomy. The worst part was how terrible she felt about the whole thing. She refused to let her husband see anything and was in tears the entire time, telling him he should go. She doesn't deserve to have him now. For the most part, he just cried, attempted to hold her hand, and told her he loved her and could never leave. My dad is a gynecologist and told me this story. He treated a girl that had trick, green, foamy discharge, who had it for months before coming in. He told her to take the medicine right away and continue it completely. A few weeks later, she comes back in and she still had the green, foamy discharge. My dad asked why she stopped taking the medicine, and she said, well, my boyfriend really loves the taste. I was chaperoning a procedure my doctor was doing on a woman. She had an ingrown hair that had turned into a cyst on her labia. This doctor wasn't particularly good at cyst extractions and busted the sac. It sprayed in his face. I was retching and trying to console the poor woman at the same time. She was crippled with embarrassment. My mom's a labor and delivery nurse, so she sees quite a lot of cooch and swap stories with gynos all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy shit they stuff in Easter baskets, out of a vagina. She didn't ask, and the patient didn't explain. Worst situation I was in was this homeless woman who had a rainbow of colors coming out of her vagina. Each color distinct. Didn't smell good. I didn't know what the hell to make out of it, so I called in my preceptor, who was equally baffled. We ran some tests on her, and it turned out she had something like a dozen simultaneous infections of her cooch. My stepdad is a retired OBGYN with 45 years experience. He told me the worst case he ever dealt with was a patient he performed a hysterectomy on just after he finished residency and put the paperwork down he needed for board certification. The examiners noticed that a few days after the surgery, the patient needed 7 units of blood. The examiner was obviously concerned, so my stepdad explained to him that the woman's husband raped her days after a major surgery and she almost died. He still says that's the grossest situation he's ever been a part of. Edit. My stepdad saved her life and passed his boards. I used to work for a urologist, and one night he was on call for the local hospital and a morbidly obese woman came in with painful urination, hematuria, blood and urine. Due to her size, they decided to put her under anesthesia and do a cystoscope to see if there was anything unusual about her bladder, and once they had her on the table, the doctors spread her legs. He said the first thing that hit him was the smell. It was atrocious. He went on to find what looked to be a smashed and rotted sandwich in the folds of her buttocks and thigh area. Once the patient woke up from the procedure, he asked her about it, and her reply was, "Oh yes, I did lose a sandwich a couple of weeks ago. I just thought I ate it and forgot." This is a true story. As a medical student, I had to do a pelvic exam on a morbidly obese lady who thought she was labor. After several attempts, I just could not get an accurate view with the speculum due to the sheer size of this lady. As such, I had to call my resident in for help. As the resident attempted to do a speculum exam on this patient, her first couple of attempts were unsuccessful as mine had been. However, on her third attempt, she was able to pass the speculum into the vagina cavity. Then the patient all of a sudden started screaming really loudly. We weren't really sure what had happened, but upon closer inspection, the woman's pannus, or her belly fat, had become caught on top of the speculum and had actually gone inside the vaginal cavity. So in essence, her belly went inside her vagina. That is definitely the grossest gynecological thing I have ever seen. My wife isn't a gyne, but she performed PAPs as an NP. One patient came in claiming her crotch reeked. She claimed the smell got worse and worse over the past week or so. My wife had a look, used a speculum, and then with forceps fished out a tampon with them. Evidently, the woman had sex towards the end of her period and forgot she had a tampon in. My wife said it was the most awful odor she ever smelled. Keep in mind that part of her schooling required her to play around with a cadaver her university had for over 30 years, and the woman's puss smelled worse than a dead body. Med student here, and I haven't done my OB/GYN rotation yet, so I'm sure there's far worse to come. But during a placement at a general practice clinic, I did see one woman a week after she had given birth. She'd had an episiotomy, a cut from the vagina towards the anus to prevent tearing during the birth, which had become infected. It looked, and apparently was, excruciatingly painful. No, an episiotomy is not cutting the taint until the vagina and anus are just one big gaping hole. It is a cut in the posterior wall of the vagina, either in the direction of the anus or off to the side, basically just to widen the vaginal opening to aid the passage of the baby if there's a risk of tearing. My mother describes her worst experience was a patient who left a tampon in during month 1. During month 2, she put another tampon in. During month 3, she put yet another one in. My mom has a pretty strong stomach, but she gagged as she pulled that out. The whole office stunk terribly, she said. My father's experience is not really nasty, but pretty terrible. My dad is on call and is called in to stitch up this girl, 16 years old, and goes to a rival high school of mine. He spends 2 hours or so, I guess that's a long time, I don't know really, stitching her up from her belly button to her anus. Somewhere along the line, he notices that she was pregnant. After he is done, the father of the girl was there, and my dad just says, "Where's the baby?" Father freaks out and screams at my father. "WTF, are you talking about? My daughter isn't pregnant." Cops go to the girl's house and find the baby in the closet with a sock in its mouth. Guy freaks out, asks my dad what he should do. My dad just says, "Get a lawyer." The girl got off too. When my husband was an intern on a public hospital here in Brazil, he told me about two nasty cases. A woman walks in complaining of a foul smell on her vagina. Upon closer inspection, the doctor pulls out not one, but 3 condoms that were lost in there. She said that the last time her boyfriend had lost a condom inside her had been about a month before. Same complaint, foul smell. Doctor examines and finds pieces of raw, rotten beef. The lady explained that she left a piece of steak in there for about a week so she would cook it to her boyfriend and they would be together forever. And that was when I lost my faith in mankind. My old friend is a gynecologist, and she once had a really old 70-years woman come in complaining of vaginal pain. It turned out that she had been having sex in her urethra her entire life. I was chaperoning a procedure my doctor was doing on a woman. She had an ingrown hair that had turned into a cyst on her labia. This doctor wasn't particularly good at cyst extractions and busted the sac. It sprayed in his face. I was retching and trying to console the poor woman at the same time. She was crippled with embarrassment. My mom's a labor and delivery nurse, so she sees quite a lot of cooch and swap stories with gynos all the time. I think my favorite story is the time she fished Easter grass, that plastic stringy shit they stuff in Easter baskets, out of a vagina. She didn't ask and the patient didn't explain.